you decided that you want to become a nurse practitioner, but now you have to decide which nurse practitioner program you want to apply to. And a lot of times you have to make the decision of what kind of nurse practitioner you want to become when you apply for nurse practitioner schools. In this episode, I'm going to talk about pros and cons of becoming a family nurse practitioner. Hi, I'm Miki Miura. I'm a family nurse practitioner in Hawaii. I've been a nurse practitioner for 10 years. I have a family nurse practitioner certificate, but since I graduated from nurse practitioner program, I've been specialized in women's health. Based on my personal experience and also stories from my nurse practitioner colleagues, in this episode, I want to talk about pros and cons of becoming a family nurse practitioner. Like I said in the beginning, when you apply for nurse practitioner schools, a lot of times you have to decide what kind of nurse practitioner certification you want to go for. More than 70% of nurse practitioners have family nurse practitioner certification. Family nurse practitioner is the most common nurse practitioner certification. But there are also other certifications such as women's health, pediatrics, neonatal, psychiatric mental health, adult gerontology, acute care, adult gerontology, primary care, and so on. So in this episode, I'm going to focus on family nurse practitioner certification, which I have. So there are many pros and cons to become a family nurse practitioner. To me, becoming a family nurse practitioner was one of the best decisions, but I'll explain to you why. First pro of becoming a family nurse practitioner is you will get more job opportunities. This was the reason why I chose family nurse practitioner track. Before I applied for a nurse practitioner program, I heard from somebody, I can't remember who told me, but I'm very thankful to that person because it really guided me and helped me with my career. But back then in Hawaii, there are a shortage of jobs for pediatric nurse practitioners. I heard that pediatric nurse practitioners have a difficult time finding jobs in Hawaii. And I have pediatric nursing background. Pediatrics has been always my love and passion. I used to imagine myself working in pediatrics only. But when I heard that a lot of pediatric nurse practitioners have difficult time finding a job in Hawaii back then, it made me think that maybe I should go for a family nurse practitioner program because I came to United States with the student visa. So I really needed to find a job right after graduation. And also I needed to find a job that can sponsor me to get either work visa or permanent residency. So finding a job was very critical, especially I was an international student. And I just decided, you know what, as a family nurse practitioner, I could still work at a pediatric office. I still have that option, but I want to make sure that I can find a job after graduation, which turned out to be one of the best decisions I made in my life, especially because I knew that I wanted to be in Hawaii. I didn't want it to go anywhere else. So that was very important. So becoming a family nurse practitioner will probably give you more job opportunities because you can work in so many different fields. You can work in a community health center. You can work in a woman OB/GYN office. You can work in palliative care. Some family nurse practitioners work in an inpatient setting. You can work at an ER. So you have a lot of job opportunities. Because as a family nurse practitioner, your target population is very wide. You can see babies, you can see elderlies, you can see women, men with different genders. Becoming a family nurse practitioner gives you more job opportunities. And why is it important to have more job opportunities? Because when you have multiple job opportunities, you can pick and choose which job offers you want to take. You can negotiate wages, salaries, and employment conditions. And you can decide how you want to work, when you want to work, when you have multiple job options. But if you only have one job options, that's all you can get, then it is hard to actualize all the wishes that you have. Another pro, especially this is important if you are in a state gives full practice authority to nurse practitioners and you are planning to open your own practice, you want to have a wide target population so you can have enough clientele. Becoming a family nurse practitioner, you can see pretty much everybody, especially if you're in a primary care. So in terms of thinking of the revenue for your own business or practice, it might be very important for you. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Another pro of being a family nurse practitioner is you are trained to treat variety of primary care, urgent care conditions. Although I'm specialized in women's health, a lot of times my patients feel comfortable talking to issues especially in their private area, like on the breast or down there, because I'm also female and they feel comfortable talking to me. And a lot of times they ask, I know I should talk to my primary care about this issue, but I honestly feel more comfortable talking to you. Can you take a look at my skin on the breast and stuff like that? And if you are a family nurse practitioner, you are trained to take care of those issues. So you feel more confident and comfortable taking care of those issues. I know one women's health nurse practitioner worked in the field for decades and decades, but decided to go back to school to get another certification, which was a family nurse practitioner certification, because she encountered a case that the woman asked her to take care of many primary care issues, and she felt like with the family nurse practitioner certification, she can take care of her patients better. Having a family nurse practitioner certification gives you more skills and training to take care of a variety of primary care issues. While there are many pros of being a family nurse practitioner, there are also cons. And one of the biggest cons that I can think of is that your training that you receive during nurse practitioner program is very broad and shallow. Every semester, you might go into different fields. Like one semester, you learn in women's health. Another semester, you learn in pediatrics. And then another semester, you focus on adult health. And then another semester, you focus on geriatrics and so on. Each semester is on 3 months or so. And by the time you finally get a hold of the main ideas in the field and you feel a little bit comfortable, then you have to move on to a different field and you forget what you learned during the last semester. So by the time you graduate, you might feel like you are unprepared because you are exposed to so many different conditions in different fields, but your knowledge is very shallow and you feel like you're not prepared to work independently. Whereas if you go into a specialized nurse practitioner program, let's say women's health, you do women's health for 2 years, 3 years, you repeatedly learn the same issues, similar issues, then it will stick to your brain a little bit better. Being a new grad is especially hard for family nurse practitioner program graduates because you might feel very unprepared, which I totally felt that way. But it's okay. You're gonna get trained. You have to find an employer who are willing to teach you and be patient. But probably after 6 months or so, or some people may take less time, but you can learn and you can be independent. You can be competent nurse practitioner. But it's just that one of the cons is you might feel unprepared, not confident at the time of graduation. So final thought on whether becoming a family nurse practitioner is a good idea or not. It depends on your preference. It depends on whether you have a specific preference of which field you want to work in. If you are like, I can do women's health, I can do pediatrics, I don't mind doing the dermatology and so on, maybe becoming a family nurse practitioner is a good idea. But if you decide, I know I only want to do psychiatric mental health, then you should go into psychiatric mental health because then you are trained really deeply in that field. Another thing you should think about is if you are very specific about where you want to live. If you want to live, let's say, only in Hawaii, you should look in and see whether there are some needs for the specialty that you want to get into. Now, there are many pediatric nurse practitioners in Hawaii and they find job fine, but back then it was different, and that's why I chose family nurse practitioner track. But very important, if you know that I only want to live in this community or the state or city, then you should do some research and see if there are needs for the specialty. But if you are okay to move around in the United States, then maybe you can prioritize which specialty you want to go into. Another option is you can always go back to school and get double certified. Some programs give you the double certification at the time of graduation, although it's going to be extra hard because you have to learn twice as hard during the same period of time. You can also decide to go back to school, get a second certification. But these are the things that you should think about when you apply for a nurse practitioner program and see if making a decision of becoming a family nurse practitioner suits your career goal. I hope this episode was helpful for you. If you have any comments, questions, requests for future episode, please don't forget to write down in the comment section. All right, I'll see you in the next episode. Aloha.